A difficult topic to talk about, but couples with concerns certainly aren't alone. We're talking about infertility. It isn't just a problem for women. This morning, we're trying to understand male infertility, and here to discuss it is Dr. Bieniek from Hartford Hospital. Good morning. Thanks for being with us.
Thank you for having me.
Let's start off with what is male infertility and what factors go into it?
So to start off with, infertility is really a problem that a couple is struggling with.
Right.
And we often think about couples trying to struggle to get after a year of trying without success. And this really affects almost 15% of Americans and individuals worldwide, actually. And if you look in the U.S., this is almost 7 million Americans. So it's not a small problem by any means. And if you look at the specific factors involved in a couple's fertility, about half the time there may be male factors identified, maybe problems with sperm production, transport, or hormone production, or sexual function as well.
Now, it's something that, automatically a woman might say, okay, let me go get evaluated,
Right.
Let me see what's going on. But now with infertility treatments, it's both partners, the male and the female, that have to really look at everything and be evaluated. What goes into that evaluation?
Well, I think it speaks to the fact that women are more likely to seek medical care. Men don't have an equivalent of a male health expert, and that's something that's coming more to the forefront now. But thankfully, the male evaluation is relatively simple. The first step is just getting them in the door, though.
Right.
But once they're in the door, typically we'll do a history and physical examination, and they'll be asked to complete at least 2 semen analyses. And the reason is there's a lot of variability amongst those tests, so you need to have a couple numbers to compare to. And if we see any concerns there, we may ask them to do some additional blood work or see a fertility expert such as myself.
Okay, and also, where do they go for that first step? You're a urologist as well,
Correct.
So that's who they should go see?
Well, it's a good question. I don't need to see everybody.
Okay.
And really, they can be screened by their own family doctor.
Okay.
I'm happy to see anyone, but typically they need to have a history physical examination directed at certain aspects, and then they need to complete a couple sperm tests. Okay, and if there's concerns on any of those fronts, then I'm here, I'm available to help, to answer questions as well.
Okay, let's say that there is an issue that was found. What are the next steps? What are the treatments, so to speak? Right.
Well, the first thing I recommend to any man trying to get pregnant is they should be on a multivitamin. There's a lot of studies showing that the vitamins and minerals support sperm health and really healthy lifestyle. Beyond that, we need to target therapies to what each individual man, what we find, what the evaluation reveals. And so in some men, medications may help. They may help boost the testicular production of sperm and of testosterone. But one key point, and this is something I want to bring up here, is men should not be on testosterone. Testosterone actually causes the opposite effect. It shuts down sperm production.
Okay.
So if anybody's on testosterone, prescribed or not, and you're trying to get pregnant and struggling, that's probably the reason why.
Okay.
And lastly, surgeries might be indicated in some men. Some men struggle with issues like varicoceles, a lack of sperm in the ejaculate for various reasons, or a prior vasectomy. And in those cases, we may talk about surgical options.
All right. Talking about that prior vasectomy, they can actually be reversed?
Yep, they can. So it's an excellent topic to bring up, especially after Father's Day. And when we talk about having children after a vasectomy, there's a whole discussion I go into. First, we talk about simple things. There's always options of adoption, donor sperm, using somebody else's sperm if you want to avoid procedures. We can aspirate sperm, basically suck sperm out, and use in vitro fertilization. Or really the most cost-effective strategy for having a biologic child is often doing a vasectomy reversal. And can often be done on an outpatient surgical basis and through mini incisions not much larger than the vasectomy itself. And one myth I often hear is that vasectomy reversals may not be effective after a certain number of years. And it really isn't true. They really have high success rates despite the interval since your vasectomy, although sometimes the reconstruction is a little bit different.
What about I don't know if it's a myth, so I'll ask you, but everyone hears, okay, well, maybe you switch to boxers instead of using briefs. Are there simple steps that people can do in their everyday lives to help with their fertility, maybe if they're just starting to try?
Right. Excellent question. There's a series of websites out there. There's all kinds of papers that have studied this as well. The boxers and briefs has been largely dispelled.
Okay.
There was one study that came out recently that said men that wear loose underwear and some that may go commando may have better sperm counts, but that was really a small group, so I'm not sure I'd put all my eggs in that basket. But I generally encourage try and You want to limit the amount of drinking you do. Certainly smoking and drug use is not recommended. And taking that multivitamin. There's certain vitamins and minerals, and I provide handouts to my patients about what may be best for them.
So it really also comes down to making sure that you're being healthy, not only for you, but for any potential children that you may have.
Oh, certainly, certainly. It affects the sperm health. Men are making millions upon millions of sperm every day, and so there's little effects based on everything you do every day.
All right. Well, thank you so much for joining us and breaking down this issue for us. June is Men's Health Month, so this is an important topic to just, even if you're not even trying to have a child,
go see your doctor.
Just go see your doctor. Make sure that everything is okay. Well, thanks again.